Again, I'm Dr. Ashley Ayub. I'm in the Internal Medicine, Critical Care, and Emergency Services here at Animal Specialty Hospital, Florida. The room we're currently in is called our Special Procedures Room. This is the room that I use to do a lot of my imaging studies, one of which is ultrasound using this small machine. The way this works is basically with this small probe, we gently place it over the abdomen or the thorax, whatever body cavity we're looking to image, and on the screen it shows up the different organs within the body. It allows us to look at their size, their shape, the appearance of the tissue within the body from outside the body very non-invasively. It's very painful. I'm sure a lot of you have had ultrasound exams, and it's just kind of like a little belly massage when we do it. So it's something that's very comfortable, very quick for the patient, and very non-invasive. It allows us to see a lot of their internal organs that we couldn't see otherwise. Another equipment that I use in this room is this machine over here, which is our endoscopy unit. There is flexible and rigid endoscopy, and an endoscope is basically a very small scope that's inserted into a body cavity, whether it's the nose or the GI tract or the colon, that allows us to image those tissues within that body system. It allows us to look at the tissue structure to assess if there's any inflammation there, if there's any infection there, if there's any sort of tumor or masses there, and it allows us to be able to get a small tissue sample of that so that we can look at the cellular structure to figure out exactly what's occurring and why we're seeing the signs in those animals. Because they are veterinary patients, and we are having to insert a little tube in their body, we do it under general anesthesia. It typically takes anywhere between 30 minutes to an hour depending on the procedure that's being performed. It's very gentle anesthesia. They tend to recover very quickly and very well from it and tend to go home the same day. It is a non-painful procedure, so waking up from it, they don't feel any pain. And again, it's a pretty good non-invasive way for us to be able to really get tissue samples from structures like the stomach or the small intestine or the colon. So next I'll take you out and I'll show you our emergency room. So now we're out in our emergency room, which is our triage area. If your pet were to come in on emergency, they would initially be triaged back to here for assessment. As you can see, we have 3 tables set up here, so we can be working with multiple animals at any given time. In this room, it is set up for really anything that we may need. Up at the top you can see we have central oxygen, so we can supply oxygen supplementation to these patients. We have central suction, so if we needed to perform suction for any reason, we have that available. Right here we have an IV pole, and this is basically a pressure bag, so we're able to put IV fluids in here and get those into the patient pretty quickly if they require large amounts of fluid resuscitation, which a lot of emergencies do. Down here at this 3rd table, this is actually a surgery type table. It's not for the types of surgeries that Dr. Havoc and Dr. Karn showed you, but for things like lacerations or bite wounds, for us to repair that, we have this special table out here. We have our own anesthesia unit out here that we can use, and we have fluid pumps, multiple parameter monitors, so we can keep a close eye and monitor all the vital signs on your pet while that's being performed. Next, I can take you guys over to ICU so I can show you some of our inpatient hospitalization areas. Here we are in our intensive care unit. This unit is used to house very critically ill patients who need to be monitored continuously. As you can see, we have many smaller cages in this room for the smaller animals that have blankets and towels and pads in there so that they're very comfortable during their stay. We have fluid pumps and monitors to always provide them fluid and monitor blood pressure and heart rate and oxygenation levels. We have large glass windows to the outside, so there's a lot of ambient air or light that comes in, so the patients always know what time of day it is. They get plenty of sunlight and environmental stimulation while they're here. Over on the other side of the room, we have these large glass front runs for our larger patients. The glass allows us good visualization of them at all times, and they're large enough so the larger dogs can stand up and turn around and move very comfortably while they're here. Some of the specialized equipment that we have in this room includes mechanisms to administer oxygen continuously. If you'll notice right here, this is called a mechanical ventilator. This is if a patient is not able to sustain oxygenation or breathe on its own. We're able to insert an endotracheal tube and allow this machine to do the work of breathing for them until they're able to do that on their own. Just next to it here is our oxygen cage. An animal in here will be provided continuous oxygen while they are able to relax in an oxygen-rich environment, which decreases their effort in breathing and increases their oxygenation until their underlying disease process has been resolved. Over next to this is our emergency crash cart. This is used for CPR. It is filled with endotracheal tubes that we can use, different types of emergency drugs like epinephrine and atropine, which are commonly used for CPR. And then on top of this, we have this machine which monitors heart rate and rhythm, and it is a defibrillator, which you often see used in humans. If the heart rhythm changes to a very specific rhythm, we are able to provide a shock to try to get the heart rate back to normal. That's about it for this room. Next, Dr. Havig and I can show you a couple of other areas of our dog and cat special care units in the hospital. Here we are in our cat special care unit. This is used for hospitalized cats who are not as critically ill as those patients that are in our intensive care unit. Again, we have cages in here with pads that are soft and comfortable for them. We provide them all blankets and towels, litter boxes, so that they're very comfortable during their stay here. This is Tinker, a patient who's been staying with us for a couple of days and is just getting prepared to go home today. In this room, we also have windows to the outside, so they have ambient light and environmental stimulation. Additionally, we have windows that look out to the rest of the hospital and into ICU, so that we always have constant visualization of all the patients in the hospital. Next, we'll take you over to the dog special care unit, and Dr. Havik can walk you through that room.
This is our dog special care unit at Animal Specialty Hospital. It's a separate unit from the cat ward, and that's to make sure that the cats and the dogs are both comfortable without the stimulation of one versus the other. But we've got some nice big runs here for our bigger patients. We've got pads and bedding, blankets to make sure that they stay comfortable throughout their hospitalization stay. We've got some smaller cages with nice pads in them for some of the smaller dog patients. And we have very large windows on all sides of the dog special care unit to make sure that there's always a direct line of visualization into the area, and we can keep a very close eye on them. It's directly across the hall from our intensive care unit.
For the final room on our tour today, this is our in-house patient visitation room. We use this room for patients that are hospitalized when you come in to visit with them, or if you just need a quiet, comfortable place to be with your pet while you're at the hospital. We've set this room up to feel more like a home environment. It's got a comfortable couch here that you can relax with your pet. We have soft ambient lighting in this room, and we have a nice soft rug that you and your pet can relax on. You know, we use this room whenever you come in to visit a patient that is in the hospital, or if you come in on appointment and we'll be here for an extended period of time, we can have you relax in this room with your pet as well.
We just wanted to take this opportunity to thank you for coming on a tour with us of our hospital, the Animal Specialty Hospital of Florida. This is our hospital administrator, Eric Carnes.
We want to thank you for coming on a tour of our hospital today. If you ever need to reach us anytime, you can always give us a call, 263-0480. Thanks again, and we'll see you soon.
Hi, I'm Dr. David Randall. Work at Big Cypress Animal Clinic on the East Trail. It's a member of the American Animal Hospital Association, a full-service hospital. We've got great receptionists, full-service exam rooms, lab right on the premises, x-ray, surgery, and a complete boarding service. You'll love it. If you stop in, we'll give you a tour. Come by at any time. 774-2233. Big Cypress Animal Clinic.
G'day. Does your dog have a nickname? If your dog's behavior keeps you inventing new nicknames, remember this name. Barkbusters, the world's most trusted dog trainers. They'll transform your dog into a happy, obedient companion in just 2 hours in your home and provide a lifetime guarantee. Rate your dog's behavior at barkbusters.com. Barkbusters, training dogs the Aussie way.
All right, this is the x-ray of the lump over here on the right side by the last few ribs. And this area over here, it appeared to be just fatty tissue with a little bit of red blood cells. And the bone tissue of the ribs themselves look fine. On a second view, right over in this area here, again, the ribs look fairly fine. So I think what we'll plan on doing, since Nikki needs a dental, since the teeth are kind of yucky, is going in there and just removing that lump and stuff at that point if you want to do it, okay?
Yes.
It's no rush. It's no rush.
Yeah.
Whenever you want to do it and stuff.
Okay.
We found no cancer cells.
Okay.
It's not a bacterial infection.
Okay.
It appears to be some scar tissue, and it's very possible that, depending on the veterinarian, let me show you how I give a shot. Let's turn around this way. Okay. You got his head?
Yes.
Okay. Her head. Okay. 99% of the time, if I give a vaccine, it's going to be right in this area here, right? The love handles. Okay. Sometimes I'll give a vaccine here. A lot of vets and a lot of technicians pick that area right there. They'll pull it up off the rib, give a shot,
Exactly.
and that's probably
Exactly.
a vaccine that was done, okay? And I guess each doctor finds their own place, because I know if I have something feeling like that right there, it's a reaction to my shot. Just like if you get a tetanus shot, you get a lump there sometimes. So I think it's probably nothing, okay? If it bothers you in the family, we'll take it off. Let me see what those teeth look like. Oh yeah, they're green, Dad.
Wait, they're yellow.
All right.
I do them every week, honestly.
All right, I want to do professional dental someday and stuff, okay? Let me tell you, it's not bad.
Yeah.
Sedative, okay? Complete cleaning, scaling, $225. What a
How can
bargain.
you beat that? That's a
You
great
can't
price.
beat that.
That's a great
Okay, there you go. See, he even thinks it's a good price. All right, hold your dogs to jump off. I'm going to finish out this
Thank you very
segment
much,
right here, okay?
It's free today, right? Because we're on TV.
It's double the price because we're on TV. Exactly. See, you know exactly how it works around here. Anyway, I'm Dr. David Randall. This is the Dr4Pets Show. Thanks for watching. In the next couple of weeks, I'm sure we'll go back to our live call-in shows, but right now we'll just have our repeats. Missy lives, my lab. Thanks to the University of Florida, they're doing a great job. You got to see some interesting things in the short time. You got to see some more ultrasounds, and just some examinations, some x-rays, okay? It's another day in the life at Big Cypress Animal Clinic, Dr4Pets Show. I hope you enjoyed the ER. It's open, it's in Naples, it's the place to go to, okay? Good day.